Good morning, everyone, and welcome to episode 271 of the On Air Advocate. Where at the On Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who may not know me, my name is Tammy Flynn, and I am the host and producer of the On Air Advocate. And I am super excited if you are joining us here this early Wednesday morning, or if you are catching this on the replay. Now, as always, if you think any of the content that we are talking about this morning could be relevant or helpful for anyone in your circle, please hit the share button. Now, if you guys have been following us on social media, you know that we have shifted our gear to change our focus over to Stroke Awareness Month. And I am so excited to have here this morning with me, Leah Forlenza. She is the chest pain and stroke coordinator for Ascension St. Joseph. Good morning, Leah.
Good morning, Tammy. Good morning, everyone. As Tammy already said, May is Stroke Awareness Month, so I'm really excited to be here to talk to you about facts about strokes, ways we can prevent strokes, and answer any of Tammy's questions. So just some facts about stroke. 80% of all strokes, first strokes, are preventable. And I think that that's a really powerful statement. 80% of the time, we could find a way to prevent that. And 31% of all strokes are happening to people less than 65 years of age. I also think that's very powerful. I think that people automatically assume that stroke is, well, that happens to old people. Well, that's absolutely not the case.
Right. And that is why I'm so happy to have you here this morning, sharing with everyone about this and us kind of diving into what we're going to call Stroke 101. But before we take a deep dive into my long list of questions for you, Leah, can you tell us just a little bit about your background? I know that you are the coordinator at Ascension St. Joseph, but what is your background and what led you into this area that you're so passionate about?
So I graduated from Cardinal Stritch University here in Milwaukee area in 1996, and I have been working in the inner city as an emergency department nurse ever since. And this opportunity to work for Ascension St. Joseph to try to make a difference with patients that end up with heart attacks and strokes, I couldn't pass it up. So basically, I've been working in this area of the city for my entire career. And so an opportunity to make a difference with this patient population just couldn't be passed up. I was so excited.
And how long have you been in this stroke, the chest pain and stroke area of the hospital?
2 years now.
Awesome. Wonderful. So with that, you have been in this field for a long time, and I'm sure that you have seen numerous people, especially working in the ER and whatnot, that have come in with strokes. And we'll kind of get into that fast action of if you're noticing a stroke as we go on with the interview. But to start with, what is a stroke for those that may not know?
So a stroke can be one of two types. You can either have a blood clot that cuts off the blood supply to your brain, or you can have a ruptured vessel that causes bleeding into the brain. Both can be caused by a long-standing history of uncontrolled hypertension in particular. Both of the strokes can have catastrophic results, but they both have a little bit different group of symptoms that happen at the onset. So whenever you're ready to talk about that, I'm ready.
No, I think that we were talking before the show really about family history. And is there any component when they have a stroke that's connected genetically?
So we know that women have more strokes.
Okay.
We know that disproportionately African Americans have more strokes. But we also know that family history of hypertension and diabetes, those are genetic components. Now, yes, genetically you could end up with one of those diseases that puts you at a higher risk, but it's the control of those diseases that really, that's the most important part of it. They are controllable. Again, 80% of all strokes are preventable.
So, yeah, when I read that, I was like, wow. But I go back to our heart series that we did. I believe that was last month, or maybe it was the month before, but our heart series that we did. And they talked a lot of times about, especially in women, that they don't even know they have high blood pressure.
Correct.
You
We,
know?
we are the caregivers. We put all of our needs aside day in and day out. And, the economy hasn't been very great. So even if you don't feel well, you put your head down and you go to work because you got to feed your kids. And so there's definitely a disparity there.
Yes.
For women and particularly Black women.
Yes. And so what are some of those signs and symptoms that we should be watching for? I'm going to kind of give you a double question. And then is it any different in men than it is in women?
So the symptoms are of a hemorrhagic stroke or an ischemic stroke. Those are what they're called. So the bleeding one is called the hemorrhagic stroke and the clot one is called the ischemic stroke. And there really isn't a huge difference in between how men and women present.
Okay.
But there is a difference in how they present from one to the other.
Okay.
A lot of times when someone has a hemorrhagic stroke, the bleeding one, they'll have symptoms, nausea, vomiting, worst headache of their life is what you'll hear when they come into the hospital. So you might get some vision changes, you might get some dizziness, and then ischemic strokes are the classic that we talk about, where you have a facial droop, one of your arms doesn't work as well as it should, your speech doesn't sound right. But there's also a dizziness component with that stroke as well. And those are the toughest strokes to diagnose. And they're the strokes that affect the back of the brain. So what you'll get is sort of the room spinning feeling. So vertigo is a big thing. And again, sometimes people get headaches with that, sometimes not. But, people just need to know that no one is going to shame you for coming to the emergency room when you have the worst headache of your life, because we know what that can mean.
Right. And is there any range, like for whether you're having a massive stroke or a mild stroke? Because sometimes can it be misdiagnosed? So like you're saying, like the symptoms of a headache or vertigo and you're dizzy, because, if you're having a minor one, is there a such thing as a minimal stroke where you wouldn't really know to discern it, where it could be misdiagnosed?
I wouldn't say misdiagnosed, but I would definitely say that because a stroke doesn't show up on the classic test that we do for people who are dizzy and have headaches, which is a CT scan, it takes up to 2 to 3 days for the stroke to actually show up on that imaging. So what I would say is not a misdiagnosis, a missed diagnosis. So you can have someone who has that mild headache or maybe has a little bit of numbness and tingling. And then if you do an MRI on them, then, they had a small stroke. So depending upon where the bleeding is or where the clotting is happening, that is going to tell the tale as far as how severe the stroke is going to be and how bad the disability could be after. Okay. But the really good news is if you come right away, if you come early, there are things that we can do.
And what are some of those? Well, I guess let's back up for a second. So if you are thinking you're having a stroke or your loved one is seeing you thinking you're having a stroke, what are those action steps that should be taken?
So call 911. And I know that people get very concerned about bills, but the bills, if you would crash on the way to the emergency room, if you would hurt someone else, and you have to make sure that you have a professional there. There are differences in the places that they might take you based on your symptoms when you do call 911. So there are facilities that provide a primary level of stroke care. And then there are facilities that provide a comprehensive level of stroke care. And based on your symptoms, when the ambulance arrives, they can automatically take you to the comprehensive center where every treatment option available is right there at their fingertips for you. Right.
And so they call 911 and then what do they do next?
So based again on the symptoms, you could be taken to a primary stroke center or a comprehensive stroke center, and then you're brought to the emergency room, and then we start the process. So it's very quick. So we're going to check your blood sugar to make sure that that's not what's causing your symptoms, because that's probably the most, that mimic is what we see the most. So you have sort of a facial droop and you have someone who's not acting right and their speech might be slurred, and then you do a blood sugar and it's very low. That happens a lot. So we try to get the mimics out of the way so that we're not doing testing and providing care that's unnecessary at the time. Right. But you only need two things to be able to start treating an ischemic stroke. And that's to know that their blood sugar is normal and to know that they are not having the hemorrhagic type of stroke. Once we know those two things, there are medications that we can give to break up that clot and to stop the stroke from happening and reverse the symptoms that the patient is having at the time.
Okay. And at home, though, when you call 911, while you're waiting for that ambulance to get there, is there anything like that you should be doing with your loved one if you're waiting with them?
So there are a lot of, with heart attacks, they always say take an aspirin. I would say that, there really isn't anything that you can do other than to try to remain calm.
Easier said than done.
Easier said than done, for sure. But what you wouldn't want to do is to take aspirin or any other medications that might interfere with what the ultimate gold standard treatment would be, which is alteplase, or TPA, they call it. So I would say just remain calm and understand that the closest hospital to you, the hospital that you love, the one that you go to for all of your needs, might not be the one that will serve your needs appropriately today.
Right. Definitely.
So when the conversation happens, be ready and be on board to go to that different hospital that have the other treatment options for you or your loved one.
Right. That's in the best place for them to be. So once they get there, obviously, if you're there in enough time, there's the options to break up the clot, right?
Correct.
When is there not the options? Is there like a window of time that you can have that in?
There is a window of time. So we call stroke alerts on all patients that have had symptoms less than 24 hours. But the reason that we do that is because our comprehensive sister hospital, Columbia St. Mary's, they have options available even past potentially the window for the alteplase. But for the medication, we want to make sure that the patient has only been having symptoms for a couple of hours before we give that. Now, if your stroke is too catastrophic, meaning that when you come in, your symptomology, there's a scale that we use. We do an NIH scale on a patient to see how severe their symptoms are. Once you get above a certain score, what you're actually doing is putting them at risk for them bleeding. So if you receive alteplase and you're not having a stroke, the chances of you having bad side effects from that medication are right around zero. But if you have a really bad stroke and we try to give you that medication, it can actually cause bleeding and it can actually cause more harm than good. So yes, there's definitely a balancing act. But the absolute number one thing that people need to know is they need to come to the hospital right when they're having their symptoms. Now, which is tough. We've all had a headache. We've all felt dizzy.
Do you feel like a headache is the number one, like one of the number one symptoms you guys see?
With the hemorrhagic strokes, yes. With ischemic strokes, I would say it's all the classic BFAST symptoms that I know you're going to ask me about what to look for. The facial droop, numbness, tingling, arm not working, speech difficulties. What I think people don't highlight enough are the visual issues that can happen. You can have, loss of vision in one part of your eye. I think people tend to think, maybe I need new glasses, so there's always a rational explanation for what you're having. And if you're a 40-year-old Black woman, none of it tells you that you're having a stroke and that you need to go to the hospital immediately. That's the unfortunate thing. That's why we try so hard to talk to people like you who are getting the information out so that people know when they should be coming to the hospital.
Yes. Like I said, when we had the heart series, I thought the same thing when the doctor was talking about it, like, oh my gosh, those are normal things that we would be like, oh, yeah,
Yep.
that's a heart attack. I'm not having one of those.
Yep.
Now, once in the hospital and the care that they're getting, what is kind of the treatment that comes along with a stroke, and does it vary depending on the magnitude?
It definitely varies on the magnitude. So if you've received alteplase, you're going to go to the ICU for the next 48 hours so that you can be closely monitored to make sure that you don't have any bad outcomes from receiving the medication. So bleeding is one of the highest risks. So you want to be in an environment where and it's interesting because their symptoms go away and they're like, you're going to send me to the ICU and I'm perfectly fine. Yes, we are, because we're going to watch you really closely for the next 2 days. And then they will transfer to the floor for about a day and then go home. Strokes are going home after just a day or two now, depending upon the severity and what's going on. But everyone's going to get evaluated to see what their lipids look like and get started on some cholesterol medicine if they need it. Everyone's going to get evaluated to make sure that they don't have diabetes that they're unaware of and start to get treated for that. We're going to start people on an aspirin a day because we know that that is a huge part of preventing a further stroke. Starting to talk about diet, definitely talking about smoking cessation when the patient is a smoker. More time is spent on the education to not have another one.
Right.
There is actually treating the stroke.
Right. Now that kind of leads into, I have a two-part question. We're going to start with this. So once they go home and the severity, all of that, and you give the education, what does that recovery process look like for many? I mean, is it more therapy, speech therapy, PT, OT? What type of things that way?
So we have a lot of patients that get transferred directly to a rehab facility so that it's more intense and that it's every day and they're sort of living it. But then when you have patients who have milder symptoms, they do get referred to outpatient therapy. PT, OT, speech, whatever they need is done on an outpatient basis. Some patients, I've had patients who were homebound prior to their stroke, and the therapies come into the home and help them to get back to their baseline.
Okay. And that would be the next thing is, what do you think, or I guess, what are the percentages once you have your first stroke of having another stroke? I feel like I read something on that. Like once you have one, obviously you are at a higher disposition to have another one. How does that vary, and how does that vary different from men to women?
Women are always at risk for having stroke more than men. I would say that
having another one after your first stroke, because I feel like I read something along the lines of that if you've had one stroke, if I don't know whether it's if you can make it over a year's time or something without 1 or 2 years, is it like a more like 75% chance of not having another stroke?
That's absolutely correct.
Okay.
Yeah. So that first year is so important. So you're sort of rewiring your life to be healthier. And that can be very difficult. And that's where some of the disparity comes in. So again, if you have that 40-year-old Black woman who is leaving my facility and going right back to working 2 jobs and shoving some terrible food in her face once a day and having no time to exercise, I think that's the piece that's most important. I find that healthcare in general, we're all guilty of it. We're not meeting people where they're at. Yeah. So I think that we have a lot of conversations about not eating salt and, don't smoke and all of those things. But I don't think that we're drilling down into the reasons why people are not able to follow through with some of those better behaviors. And at least here in Milwaukee, and I'm sure it's no different in a lot of the other inner cities in this country, it's a food desert.
Right. And we know
So,
that, where are we getting the most inexpensive food, right? At McDonald's.
correct. Correct.
It's so much, it boggles my mind. It's like, if you want to buy something healthy, if you want to buy fruit, it's like, oh, it's $6.99 a bin, but you can go get 6 sandwiches for that price. So what choice are you going to make when funds are low?
So to the point of, we actually had one of our local grocery stores who left a semi trailer in our parking lot for the whole week last week to sell fresh fruits and vegetables and meats. And it was open to the entire neighborhood. It was open to people who work here. It was fabulous. But those are the measures that we're having to take in this town just to try to mitigate that food desert. So
yes.
If that's the starting place, I'm not sure we're meeting people where they are.
Right. And more programs. Is Milwaukee starting to implement some programs, like you said, like the semi coming? Is that a program that's actually started now in Milwaukee County?
So I think that there's a lot of really great work happening around it, but I feel like we're sort of siloed right now. So this was just one local grocery store who decided to try this for a week, and now we're waiting to hear if we're gonna do more with that. A couple of years ago, we actually had another grocery store chain that was actually going to build right inside of our hospital.
Wow.
To try to help with some of that, and for whatever reason that fell through. So I think that there are so many people right now that are so excited to try to fix these things. I think that we're going to start moving in that direction for sure. I think that you'll see more and more. So to give you another positive, one of our local big churches, actually, they have their garden on our property across the street from our hospital. So, if you can't find it somewhere, I feel like people are starting to build it for themselves.
Yes.
And that's really exciting.
Mm-hmm. It definitely is. The more resources that are there, and the more that they're in the communities, in walking distance.
Yes.
And stuff too.
Yeah.
It's easily and it's accessible that way. That is wonderful. And so if people are tuning in this morning, whether they're tuning in from, the state of Wisconsin, the Milwaukee area, or whether it's nationally, and they want more resources, they want to take more classes, they want to learn more. I know so much with the pandemic, people have switched to doing online webinars and classes and instruction. It's great because they've been offering them for free and stuff as well to get that education. Where would the best place for people to get that info be?
I will always tell people to start with the American Heart Association. And the reason why it's the best resource for anyone all across the country is it not only speaks to prevention of stroke, but also prevention of cardiovascular disease. It speaks to how to get healthy. And the great part about the American Heart Association is they're really good about having a place where you can click to find out what's available to you locally as well. So there's this awesome education that really does fit for everyone, but then you can go further into the site to find, well, where do I find that in my neighborhood? And that's why they're the absolute top best resource.
Yes, and I'm certain that for those that aren't website savvy, surfing around, there is an 800 number that that you can call and get access to those things. So after the show, we will drop that below. And Leah, before we end this great session interview today, is there anything else that you would like to leave the audience with?
I would really like for people to understand what the symptoms of stroke are. So it's an acronym. It's Be Fast. So we want you to call 911 and we want you to get care. So that's why Be Fast is just so perfect. But B stands for balance. And that's that sort of room spinning, having trouble walking sort of feeling that I talked about before. E is for eyes. So you're suddenly having problems with your vision. F is for face. So that's the classic facial droop. And then A is for weakness, arm weakness. So if you're at work and your friend is like, I don't feel very good. You as a layperson can do one very simple thing to see if they're having arm weakness, and that's to ask them to put both arms out. Because what's ultimately going to happen is one of them is going to start to drift down, and then you know you have a situation on your hands.
Okay.
So the the S is for speech. So suddenly somebody just doesn't kind of sound right. And then T is for time. So time is of the essence. Make sure that you're calling 911. What's really great about a lot of the stroke resources out there. So we gave away magnets that people put on their refrigerators at their parents' house. I would suggest that if you have loved ones who are at risk, we've had children that have looked at the BFAST on grandma's refrigerator and called 911. So the education isn't just about for our at-risk populations.
Right.
We go and teach school children about BFAST because it's so easy to follow and it's so important.
Yes, and the difference that it can make.
Yes.
Truly, truly. Well, I want to thank you so much, Leah, for taking this time with us bright and early this Wednesday morning and sharing all this great information with us. Stroke Awareness Month obviously goes through the end of May. And if you do hop on over to the American Heart Association, you can find 1,000 different ways as to how you can spread awareness, get involved, donate, put up posts, and also get greater education. So after this segment, we will drop all of that information below for you guys. But thank you again, Leah. I appreciate you being here so much today.
Thanks, Tammy, for the forum. Have a good day.
You as well. And if you guys want to know any more about the On Air Advocate, you can head on over to onairadvocate.com and you can find all of our resources right there. Have a wonderful Wednesday, everybody. Bye-bye.
Bye.